Openly waiting. I'm having to use a touchscreen computer and it's not working very well. Welcome in, everyone. Welcome to Care Concierge with CarePatrol, where education is the heart of everything that we do, including educating our friends who are social workers and nurses, which is you all. Thank you for joining us today. It's Friday the 13th. Let's hope it's a lucky Friday the 13th for all of us. Thank you for joining us on what I bet is a busy day for you just because of the day or date itself and day that it's on, Friday the 13th. Appreciate y'all for all that you do. Today, we're bringing you something a little different than what we often do in terms of our education, which is something new and something that is delivered by a colleague of ours and yours, someone who has listened to Care Concierge Education herself for a couple of years and has offered to share her expertise with us, for which we are most valuable. So we're joined today by social worker Holly Skelly, and she'll introduce herself later, but I'm so pleased that she had the interest in sharing her expertise, because it is a topic which is dear to me, and I bet dear to many of you who've joined us here today, which is animals. And in this case, in Holly's case, she's going to discuss with us animal-assisted therapy or therapies. And this, I think, is something that will be most interesting and a wonderful way to spend what is otherwise, at least in Birmingham, a sort of overcast and gray Friday. Now, if any of you are listening in any areas that were affected by the storms yesterday and last night, and there is loss of life in your community or, God forbid, in your family, we are happy to have you. Wait, is anyone seeing what?
It's a security alert screen. That's what we're seeing on your screen.
Is it in addition to the screen or just instead of?
Instead, I think instead of.
That's so weird. Let me see if we can. I'll try.
Something about the
Holly,
security.
why don't you introduce yourself and let me see if I can fix the technology. Stop share.
I'm sorry, everybody, for the technical difficulties. I thought by doing this on my work computer that it would be flawless, because I have to use Zoom all the time, and of course nothing is working.
Is it still on there?
No, I just see you now as the main screen.
Oh gosh. All right. What do you see now? Me?
Just you.
Okay, now let's try to go back to share screen. We've gotten rid of the what do we call the warning?
Uh-huh.
Okay, I'm sorry, y'all. Whenever you deal with Sean Barnes and technology,
There we go. Now we see the power
on having some issues. That's just sort of my cross to bear, I think, is having issues. Why is this not working?
Now we see the PowerPoint.
There we go. Here we go.
Okay.
All right, everyone, anybody seeing anything on the screen they don't want to see?
My photograph, no.
Other than Holly and possibly me. So let's pull up the chat room and make sure that everyone's doing well. So everyone, if you'll answer me in the chat room now that I can see it, please tell me if we need to do anything else with the technology, or if everything is fine.
It looks good to me.
All right. Now, I have placed in the chat room the survey tool. I will read it real quickly and then we'll get on with things. It is https://www.surveymonkey.com/lowercase r/uppercase C as in cat, F as in Frank, H as in heaven, X, C as in cat, V as in victory, X, lowercase, M as in Mary, E as in Edward. The link is in the chat. I'm about to hit it into the chat, y'all. There it is. Can you type survey as well, Caroline? Miss King, yes. There it is. Do y'all see it in the chat room? Yes, yes, yes. As you know, it's password protected. We'll give that out about 12:50. And you must do the evaluation to get credit for this contact hour. We are accredited by the Board of Nursing and the Board of Social Work for the state of Alabama. And it's our privilege and pleasure when we can get our technology to work to bring you folks like today's Holly Skelly to share a very interesting topic with us. And so I will cede the floor finally to you, Holly,
Okay.
and let you share with us your knowledge and experience.
Okay. Well, I appreciate everybody signing up to view this presentation today. I hope that it's informative.
I'm sorry to interrupt, Holly. Would you speak
okay.
up just a hair?
Oh, yeah. I was just saying, I appreciate everybody signing up for this presentation today, and I hope that it's informative, at least interesting on some level, and yeah, I hope that it provides maybe a tool or a resource that you guys can use in your practice afterwards. So my name is Holly Skelly. I'm a social worker. I currently work at the Mary Stark Harper Center in Tuscaloosa. I've worked here for about 3.5 years. I've been a social worker since 2015, and most of my work has been in mental health. Only really have worked geriatric psych since I've been here at the Harper Center. But in addition to being a social worker, I volunteer with an organization based in Birmingham called Hand and Paw. And we are an animal assisted therapy organization. We provide animal assisted interventions to the communities in Birmingham and also in Tuscaloosa. We serve a variety of populations, multiple different types of agencies, and we have different kinds of animals in our organization. So I've been with Hand and Paw since 2013, I believe. I've worked as a therapy pet handler. I've also served as a group facilitator for them, program facilitator. And in addition to having my own therapy dog and cat, I also serve as an evaluator for Hand and Paw. So I evaluate new teams that want to become therapy teams. So I've had a couple of different roles in Hand and Paw and been with them a long time. So animals are I'm a huge animal person, and animal assisted therapy is really close to my heart. And I've seen it be really beneficial on many occasions in a variety of situations. So I'm glad that you guys are all kind of interested in learning more about it. So I'm ready for the next slide.
Okay.
Actually, you can go to the third slide. Yeah, that's you can go back to second slide. I'm sorry. That's a picture of me. That's my therapy dog, Abel. I tried not to put too many cutesy animal pictures in this presentation. So I hope you guys don't get sick of seeing animal pictures, but there are a few, so be prepared.
Well, I'm sorry to interrupt. What is Abel? What breed?
I have no idea. I think he's maybe a Basset Hound mix. He's about 50 pounds and he's got itty bitty little legs.
He looks,
Um,
I was thinking Basset Hound or even maybe little like bulldog of some sort.
yeah, and the vet
My,
said beagle, but
oh, Beagle, I
maybe
could
some
get
beagle with the
Beagle.
ears.
My daughter's so obsessed with her 6-month-old now puppy. She got the DNA test done on it, and it's a super mutt, 50%, and super mutt is like 50% pit bull. So it's a super mutt
Oh,
with pit bull and Norwegian hound, which I've never heard of.
oh,
And she looks like that, the Norwegian hound.
oh, I need to look that up.
Yeah,
Yeah.
it's a smaller dog than you're thinking. And it's not as hairy as you expect, but the nose is what makes.
Huh. I'll have to
I'm
look that
sorry,
up.
that was a way aside point. Excuse me.
That's okay. I'm ready for the
Even the
next one.
objectives.
Yeah, so basically what I hope that you guys get from this presentation is a big one for me is to be able to explain the difference between service animals, emotional support animals, and therapy animals. A lot of times people kind of get them all confused, but they are very distinct types of working animals. Also, there are several different types of animal assisted activities. Animal assisted therapy is the umbrella term that's used, but then it kind of divides up in different areas. So I hope to be able to provide a little more insight on that. And I also hope that you guys are able to learn about all of the benefits that animals can bring to hospitals, nursing homes, assisted living facilities, jails, group homes, young people, old people. We're just going to talk a little bit about all the benefits, both for physical and emotional health that, interacting with animals can bring.
Next slide.
Yes. So as I said, before I get into more information, I like to kind of discuss the difference between a service dog, an emotional support dog, and a therapy dog. Sometimes I think of them as kind of a spectrum, but they really are, they have similarities, but they also have a lot of differences. So I usually start with service dogs. Those are the, when you go to public places, airports, restaurants, shopping malls, grocery stores, you'll see people a lot of times with like a lab. It's usually a Labrador, it's usually a German Shepherd. They're usually wearing a vest, something that says "Do not pet," work, at work. These are dogs that are trained to work for one individual, and they are specifically trained to do one task. Generally, that task is to provide assistance to somebody with different types of disabilities. So that could be something physical, like someone who is blind, or someone who has hearing impairment, someone that has seizures. It also could be for an emotional type of disability, someone that has panic attacks or behavioral outbursts. But these dogs are bred specifically to do that job, and they are assigned to a specific person to work for that specific person. They are not, out in public to interact with the public and to make us all feel better. They are working, they are doing a specific job. They are protected under the ADA, meaning that they can go out in public places. They can go on airplanes, public transportation, restaurants, without needing permission from the management owner, because they are considered a tool for that person with that disability. And there's a lot of training that goes into training a service dog. Then you have emotional support dogs, and those are also a type of working dog, but with a little less like specific training than a service dog. They have a specific task, and they are meant to serve one person, but they don't have all the formal training that a service dog has. So Someone that has like an anxiety disorder, or maybe has a fear of being in public places or a fear of flying, they may feel comforted by having their emotional support animal with them. And they are able to take this emotional support animal out in public, on flights and stuff like that, so long as they have a letter from a medical professional, a doctor, a psychiatrist, stating that they have this particular disorder, and this dog is a support system for them to be able to function on an everyday basis. Emotional support animals are protected under the Fair Housing Authority Act, meaning that if you reside in an apartment living situation that's not animal friendly, you can still reside in that dwelling with this animal, based on as long as you have that letter from your medical provider saying that it's required for you to have this support in order to live in the community. However, emotional support dogs are not protected under ADA. So it doesn't give somebody with an emotional support animal automatic right to take that dog into a Target or a Walmart or into a restaurant. Sometimes they may be allowed, sometimes not. It's at the discretion of that business or the owner or manager of that establishment. And then you have certified therapy dogs. And the sole purpose of a therapy animal is to serve everybody around them. So, they have one handler, but their purpose is to bring joy to the people they are visiting. So they're similar to service dogs and emotional support dogs in the sense that they are serving a specific purpose, but they are different in that their main goal is to serve others, to bring benefit to other people. They're not helping their handler with a specific symptom or disability. They're helping others with a specific symptom, skill, disability. Therapy dogs generally are certified through a recognized organization, usually on a national level, that usually provides the liability sort of coverage that we need to be able to visit in places like hospitals and nursing homes and assisted living facilities. But therapy dogs are not protected under the ADA. They're not protected under the Air Carriers Act or the Housing Authority Act, meaning that I can't just automatically take Abel on a plane because he's a therapy dog. Or if I live in an apartment that's not pet friendly, I can't get away with having him simply because he's a therapy dog. The only thing that certification, therapy dog certification, allows me to do is to take him on a scheduled visit supported by an organization for a very specific purpose, which is to provide a socialization, positive interaction, whatever. You might be able to take a therapy dog in some public places that if you're not on a therapy visit, but it's at the discretion of that establishment, the manager of that place that you are at. So I hope that kind of clarifies the differences between the three. Next slide. Maybe. Okay. So just a little bit of background about the history of animal-assisted therapy. There's a lot of information about how the use of animals in a therapeutic setting came about, but not a whole lot of it is documented, and some of it's kind of speculation. So I kind of tried to highlight the points in history that are well documented in the founding of animal-assisted therapy. So the first noted documentation of any sort of use of animals in a therapeutic setting was in the 1700s at a mental health facility in York called the Retreat. It was founded by Quakers, and it was originally open to serve the Quaker community, but it eventually opened up to serve everybody. And they kind of established this idea of moral treatment which was like a more holistic approach to mental health treatment. So, rather than, basically locking people up in psych hospitals for the remainders of their lives, this facility focused on rehabilitation through medication, through teaching, through hobbies, things like that. The residents at this facility often engaged in farm laboring, which involved tending to animals. And then these residents also had domesticated pets in the facility. And the people providing the care really noticed that this sort of holistic approach was really beneficial for these people that were considered disturbed. It was very calming for them. It was a way for them to have some positive socialization and a kind of a support system. The next heavily documented point in history that I could find as far as for animal assisted therapy was Florence Nightingale, who is well known in the nursing community as a pioneer in nursing. She, in her journals and papers and books, had several notes about how patients that she had seemed to respond very positively to interaction with small animals, particularly in psychiatric institutions where people were very anxious or easily agitated or aggressive. Something about interacting with these animals, the consistent petting, the sort of unconditional love that was observed during an interaction, kind of non-judgmental. It was very calming and supportive for the people in these environments.
Miss Siggers is saying that where she is, I guess this is where she lives and works. Where I am, I see people all the time with their dogs everywhere, like TJ Maxx, Lowe's, Walmart, Kroger. I just figured they were service pets. Maybe they allow animals at these places. Thanks for explaining.
Yeah, no problem. And they might not be service animals. They might just be emotional support animals. Sometimes I have a hard time telling the difference between the two, because you'll see a lot of people with emotional support pets wearing similar vests and collars and harnesses that service dogs do. So it's kind of hard to tell them apart. But if you watch the animals, if you observe them for a minute, you can usually tell in the training. Usually, emotionally support animals are basically like that person's pet, but they provide another layer of support and companionship than just a general house pet. But they don't have the discipline and the lengthy in-depth training that a service dog does. So, they may be well behaved. They may just sit in the cart just fine. But usually they're sniffing around their environment. Their focus might not always be right on their owner. They might try to interact with other people as they walk by. I mean, usually that's kind of more of an emotional support animal. A genuine service dog is not going to be seeking interaction with people in the public, because they know that their job is supposed to be on their handler at all times. They're typically going to be very quiet, very calm. I mean, if you hadn't seen the dog, you probably wouldn't know it was there. I do know that a lot of public places are becoming more open to people bringing their animals out in public. And that's great for me as a therapy pet handler and for people that are interested in doing that kind of work, because we have to be able to condition these dogs to get ready to be therapy pets. And in order to do that, taking them to places like Kroger, Target, Walmart, Home Depot, Academy is great socialization and great desensitization. And for a long time, it was hard to find places that we could practice those things. And so when you see animals in public, they could be a service dog. They could be an emotional support dog. They could just be a pet that somebody's, working on basic obedience, socialization. But if you kind of stand back and observe the handler and the dog, you can usually tell the difference.
That's
Okay.
fascinating. And you said they have like different color vest or I mean, it's almost like hospital different color scrubs. Is it like that?
I don't know if there are different colors based on what service the dog provides.
Uh-huh.
But I do know that sometimes if you go in public, you'll see a dog wearing a harness or a vest or something that says "Do not pet" or
Uh-huh.
"at work" or "working dog" or something. And you think, oh, that's a service dog, but it could actually just be an emotional support animal.
Right.
But if you step back and kind of observe how that dog behaves, you can probably tell the difference between whether it's a service dog or whether it's an emotional support animal, or whether it's just somebody's pet that they're trying to, work on obedience or, just work on socialization. Hope that answers that question.
Yeah, absolutely. And I would say that my dog, I was laughing thinking about taking my dog in like Kroger. I mean, all the aisles would be just crashing down like dominoes very shortly after we arrived.
Yeah. And Rachel had a good, ADA does not require a vest for service dogs, but it's helpful for them to wear one to identify as a service dog. Yeah, because if you take that dog into a public place that doesn't usually allow animals, you can say, well, my dog is a service animal, therefore is protected under ADA and therefore is allowed to be in this place with me, whether you like it or not.
Uh-huh.
So going back to a little bit more about the history. So in the 1930s, Freud, we all know Sigmund Freud, oddly enough, had a chow named Joffe, which if you know the chow breed, I wouldn't think of as a chow as being a really good therapy animal, but it's Freud, so who knows? But anyway, Freud found that having Joffe present in his therapy sessions seemed to be very beneficial for his clients, particularly in the initial stages of treatment, and particularly in children. He noticed that a lot of patients preferred to use the dog as sort of a stepping stone for communication in the initial stages of treatment. They felt more comfortable communicating through Joffe than directly to Freud. And Freud also noticed he could sense a patient's level of tension during a session based on what his dog was doing. So if his dog stayed at the other end of the room and seemed apprehensive about interacting with the client, then Freud knew that the client was not exactly comfortable or was somewhat tense. But if Joffe stayed close by to the client and seemed relaxed and calm and was seeking petting from the client, then Freud knew that the client was calm and comfortable and feeling good in the session. So Freud using animals in his practice was pretty common. He did it a lot, but nobody really knew about it until like 2 decades after his death, when his journals and papers started being translated. So no one really knew they weren't able to learn about the benefits of animal interaction during Freud's time until 20 years later. So then in the 1960s, there was a man named Dr. Levinson, and he had a client. It was, I believe, a 9-year-old boy who was nonverbal and had some type of either trauma or a severe mental illness. Anyway, nonverbal. And he was in a session with this client one day. He walked out of the room and left his dog Jingles in the room, not thinking anything about it. And when he came back, he observed this nonverbal child petting Jingles and talking to him. And he was stunned. And then he kept Jingles around, and he started to monitor other clients and their interactions with Jingles. And he started to recognize that children really seemed to have positive benefits from interacting with animals during therapy. And he presented this information in a paper to the American Psychological Association. And initially it wasn't really well received, but as Freud's work started to be translated and started to be studied and discussed, then Dr. Levinson's paper became, people were more interested by that, and more attention started being paid to animal-assisted therapy. And Dr. Levinson's, he's sort of known as the father of animal-assisted therapy because it kind of started with him. Freud deserves some credit, but his credit comes at the same time as Dr. Levinson. So, and next slide. Also in the 1960s, there was a man named Dr. Lorenz. He was a physiologist and a zoologist, and he was known for doing bringing a lot of modern techniques to the study of animal behavior. And the work that he did with doing animal behavior and the work that Dr. Levinson did, their philosophies kind of developed the idea of this human-animal bond. Basically, what they found in their work was that human beings appeared to have this intrinsic need for a bond with nature. In the chaos that is the human life, being able to interact with an animal sort of provided a grounding opportunity for people. Bonding with nature was they saw it as sort of a foundation of being a human being that people needed in order to address the chaos in their lives. And so their work, as it was discussed and studied, and it gained media coverage, their philosophies began to be referred to as this idea of the human-animal bond. And that kind of led to studies about animal-assisted activities, the benefits of, incorporating animals in therapeutic practice, and therapy dog programs. So when the idea of the human-animal bond was established, that, people started becoming more interested. How can we use animals to benefit people with a variety of needs? That led to the forming of at least in the United States, the forming of the organization called Delta Society, which is now known as Pet Partners. But Delta Society is really like the go-to organization on a national level for animal-assisted therapy and therapy dog certification programs. It was founded in 1981 by a man named Dr. Bustad, who was a veterinarian. And the interesting thing about animal-assisted therapy and the Delta Society at this point is that it was really the people that were driving the founding of this organization. It was a multidisciplinary approach. So you had veterinarians, you had, psychologists, psychiatrists, you had people that worked in like the animal care industry, people that did things like with dog food and animal health. It was really interesting. I'm running out of breath, sorry. Anyway, Dr. Bustad became the president of the Delta Society, and depending on what article you read, he's credited with developing the term human-animal bond. But I think he really just was the cherry on top of the cake as far as bringing attention to Doctors Levinson and Lorenz and all of the work that they did, and bringing it into a cohesive organization. Delta Society was responsible for forming task forces that promoted the human-animal bond and supported research projects in order to invest in more like empirical findings and data on the benefits of animal-assisted therapy. And it was also responsible for developing sort of the standard for therapy dog, therapy pet certification programs. And I would argue that they kind of still set that standard today. I mean, since I've been involved in the field, Pet Partners I've always gotten the impression that it's kind of it's the go-to. You go to their website, they've got a ton of information. They actually provide some certifications of their own, not only for therapy pet handlers, but for healthcare professionals that are interested in incorporating animal assisted therapy into their practice. They've got a lot. They've got a plethora of information on their website. But Delta Society was also influential in establishing other therapy pet organizations throughout the world. So it's a very important organization. Okay, so a lot of times when you hear discussions on animal assisted whatever, you always hear people say animal assisted therapy. But animal assisted therapy is actually a specific type of animal assisted intervention. And animal assisted intervention is really the more appropriate umbrella term. And an animal assisted intervention, it's basically a goal-directed task where an animal is made part of a person's treatment plan or treatment activities. It's goal-driven, and it becomes an integral part of the treatment process. These interventions are usually led by some type of healthcare professional, social worker, counselor, nurse, physical therapist, physician. But it can also be delivered by people that have certain certification to provide this service. And, you know, despite the fact that there are several different types of animal assisted intervention, the overall goal with all of them is to improve physical and social and emotional well-being. Ultimately, that's the main goal. So animal assisted therapy being, you know, probably the most well-known term as far as interventions go. This is a goal-directed intervention that is provided by a healthcare professional working within the scope of his or her profession. So like a physical therapist working with somebody in a rehab setting who's relearning how to walk may incorporate a dog into their, you know, physical therapy sessions, may have the client practice, you know, walking by walking the dog down a hallway. That's an example of animal assisted therapy. It can be group or individual in nature. But the difference between animal assisted, or what sets animal assisted therapy apart, is that the progress is usually documented on, it's part of a treatment plan, and it's evaluated by a facilitator or a provider. Then you have animal assisted activities that are they're not as goal driven, goals based as animal assisted therapy, but they provide opportunities for, you know, increasing socialization, improving overall well-being. They also provide good educational opportunities. They can also be delivered in a variety of environments. They don't have to be provided by you know, a healthcare provider. They can be provided by a volunteer who's trained to provide that activity.
Can you share or type into the chat room the website for the Pet Partners Delta Society?
I can. Let me find it.
And then, so I just want to be clear. So the difference in animal assisted therapy versus any other animal assisted intervention is that the therapy is actually documented. Is that, I mean, it's documented and performed by a clinician?
Yes.
Okay.
So, for example, like with hand and paw, you know, one of the things that one visit I might go on is I might take Abel to the cancer center here at the Manderson Cancer Center here at DCH, and I might let him interact with people while they're receiving chemotherapy. that would be more of an example of an animal assisted activity, because it's just general interaction. There's no specific goal for it other than to provide a positive experience while this person is receiving chemotherapy.
Got you.
But then like animal assisted therapy, you might, what would be an example? If a social worker is providing individual therapy to a teenager that has been through some sort of trauma or abuse,
Right. Yeah.
it might, they might be able to set some specific goal, like, the patient will be able to discuss the traumatic event for at least 15 minutes of one therapy session without becoming increasingly agitated. And they might, the social worker might use the dog as a tool to meet that specific objective.
Got you.
Does that make sense?
Perfect
Okay.
sense. And
Okay.
then Melanie Lane asked, and I'm sure you know, how is this used in prisons or jails?
Well, as a hand and paw volunteer, I haven't ever actually taken my therapy pets to a jail or prison. Since I've been with Hand and Paw, I don't think we've ever had a partnership with a county jail or a prison system, but it would absolutely be beneficial. I did when I worked at Taylor Hardin Secure Medical Facility for several years, and I had the opportunity to take my therapy dog at that time to visit with people, and it was very beneficial. I know that that's not necessarily a correctional setting, but dealing with the forensic population. We also, here in Tuscaloosa, we take our therapy dogs to a place called the WOW program, which is a rehabilitative program for female juvenile offenders. So again, it's not a jail setting or a prison setting, but these are individuals that are in the correctional system. And typically, we do sort of general animal assisted activities, which are just these kind of wellness visits, just an opportunity to provide a chance to get your mind off of whatever's stressing you out, to encourage positive socialization, to sort of create opportunity for maybe some trust or some rapport with the people in these correctional environments. But we also provide programming, which I'll get to later in this presentation, programming that we utilize the animals to reinforce positive social skills, life skills, responsibility, and to sort of modify behaviors. So I guess the short answer to that question is, I think therapy animals can be used in a correctional environment as a stress reliever, but also as a way to modify behaviors, as a way to provide sort of kind of trauma rehabilitation and counseling. I don't think it's used as much as it should be. And there are some states that actually use therapy dogs during court hearings. For example, let's say a child has to testify against someone that's alleged to have abused them. That's it's very difficult, but they have found that if they have a therapy dog present during the hearing, if the child is able to focus on that therapy animal while providing testimony, then it's a little less traumatic for them. So that's another example of how a therapy animal can be utilized in sort of a correctional setting or environment.
Fascinating.
And then animal assisted education, that's kind of like I'll get into this later in the presentation, but using therapy animals as a way to promote like literacy, improve reading skills, improve a child's ability to stay in a learning environment. And then residential animals. An example of this, I did my master's level field placement at the Tuscaloosa VA. And there were, I think at the time, 2 dogs that were owned by the Tuscaloosa VA Medical Center, that their sole purpose was to attend like group sessions and to provide sort of therapeutic support for veterans that were in like PTSD support groups or substance abuse groups. I know that the handlers would take these dogs to like treatment team meetings so that the veteran, you know, had sort of a non-judgmental support system while they were discussing stressful treatment issues. So that's just, those are the 4 main types of animal assisted interventions. Man, I thought I wasn't going to have enough information. It's
Yeah, it's 12:50. I'm putting the password in now for
sorry.
the thing.
I'm sorry, everybody. So just try to go through this as quickly as I can. So some of the benefits of animal assisted therapy or interventions, the big ones for physical health, they have seen positive impact on cardiovascular symptoms, lowering blood pressure and heart rate. They've also observed that it lowers cholesterol and triglyceride levels. As far as lung function, it improves breathing, nervous system response, immune system function. And for children, it can also reduce the risk of developing allergies or asthma later in life, exposure to animals. As far as emotional benefits, animal interaction promotes positive socialization. It provides distraction. It provides
RAPY.
Somebody is bleeding over. I think we just need to
sorry.
Shut them off.
South American river turtles.
So emotional effects, reducing anxiety, depression, protecting against loneliness and isolation, providing a sense of purpose and safety and companionship. When you look up articles, on animal assisted therapy, a lot of times the diagnoses that are highlighted are things like Alzheimer's disease, anxiety, depression, cancer, cardiovascular issues, and then autism spectrum disorder when you're reading stuff about children, and intellectual disabilities. So what are the qualities of a potential therapy dog? Basically think of just any friendly dog you see on the street, a dog that seeks interaction with other people, enjoys being petted by strangers, doesn't mind being petted in odd places, doesn't mind loud noises, sudden movements, enjoys going out in public and meeting with new people, is not intimidated by strange environments, and has a calm demeanor and is trainable. Next slide. So this training process, this information is sort of hand and paw specific, but we get our sort of training process from ITA, which is Intermountain Therapy Animals, and then Pet Partners. So the training process is generally similar across all therapy pet organizations, but for hand and paw, the animal has to be at least 2 years old. You have to have owned the dog for at least 6 months, and they have to have completed a basic obedience course. And they have to be up to date on all their vaccinations and flea and tick and heartworm prevention, and not have any health issues that require them to be on like antibiotic or antifungal medication during visitation, because it's an infection control thing. When you sign up to train to become a therapy team, You will have completed that basic obedience class. Hand and paw will do an initial interview to meet your dog. We will screen your dog for its, basic obedience skills and temperament. If your dog is accepted into the training program, there are several workshops where we focus on obedience, but really what we have seen is that usually the dogs have the obedience part down. It's the working on the human, working on the handler, and practicing different types of scenarios that you might run into in the field. And then once those workshop sessions are completed, there's an evaluation. And if you pass the evaluation, there's a new team orientation. Next slide, I'm sorry. You can go back to the slide with the pictures. I also want to emphasize, I keep saying dogs, and usually dogs are the most commonly seen therapy animal because they're easily trained and they very much seek human interaction. But you can also have miniature horses are very popular. Cats are very popular. You'll see that picture of me and my cat Akira. For a while, we had a couple of goats in the program. If you look up animal assisted therapy videos on YouTube, there's a great video. I almost included it, but a great video of a horse. He's actually a stallion. The first clip in the video is of him galloping across a field, but then the next clip is of him walking down a hallway in a nursing home. And the video explains how when he's at work as a therapy horse, he's a completely different animal. He's very calm, very patient, and they let him pick the rooms that he wants to go into. And he always picks the rooms where the person is struggling the most, whether it's somebody that's dying or maybe, something kind of traumatic. It's really a touching video. Anyway, I just like to share that, my mushy animal pictures. You can go on to the next slide. I know we're kind of running out of time. If at any point you guys are interested in either becoming a therapy pet handler or just kind of learning more about the training process, you can go to Hand and Paw's website. It's handinpaw.org, and all of this information as far as how to train you and how to train your pet to prepare for therapy work, all that information is on there. Oh, next slide. Sorry. And just a little bit about Hand and Paw. If you guys work in an agency, an environment that you think would benefit from therapy animals coming to visit, we are always seeking to establish new community partners. That information is on the website as well. We provide a variety of programs. This is just a little bit of information about, the services we do provide. Hip cares, that is sort of like the animal assisted therapy, sort of like the group that I was referring to that was with at-risk youth, promoting positive socialization and anger management. Hip heals, those are sort of like our physical therapy, occupational therapy type visits. And then hip reads, those are the literacy programs where we will visit a classroom at a school, and each student in the classroom will be paired with an animal, and they will practice reading to the animal, and it promotes confidence, boosts self-esteem, and improves literacy. Next slide. And these are just some of the places that Hand and Paw currently visits. We visit multiple departments at UAB, Children's, and DCH Regional Medical Center. We visit Glenwood. Most of our services are in the Birmingham and those surrounding areas, and then Tuscaloosa. But we visit with children, with the elderly. We do WAGs to wellness visits, which is visiting people at different banks, stores, different types of businesses. Like I've said this whole presentation, animals are beneficial for everyone. Doesn't matter what age, what problem, what environment, and Hand and Paw is always willing to help as we can, and services are free of charge. So that's another great resource. I know as a social worker working here and always trying to keep an eye out. So please always keep that in mind if you think that Hand and Paw could be of assistance. And I think that's all I have. The next
that
is
was
just a bunch of
excellent.
pictures.
Oh, do we
more
have more
animal
pictures? Oh, there we go.
Hmm.
That was excellent. I had said at the beginning of this that you were the first of our listeners to, offer to do a presentation. But we've had many guests that we approached, and you really are one of the best speakers we've ever had, Holly. I'm
Oh, really?
so impressed and so
Oh,
grateful. And I'm
thank
going to
you.
encourage you publicly to speak more often and create
you.
some other topics of interest to you, which this topic so clearly is of interest to you, that you'd like to share with others. We'd love to have you back and do other things.
Great. I can think of something.
Oh, well, let me know. It's a standing invitation, and I mean that. Just
I
email me
appreciate that.
anytime. Someone says they love the llama, I guess, in this
Oh, yeah.
photograph. Are there no, are there more? No, that's it.
Oh, yeah, I don't, yeah, no, it's just the man looking up at the llama.
Well, my wife has been wanting for years for me to get a goat, which I don't think we have enough room for a goat. And I'm a little afraid of goats because their pupils are rectangles. I don't know if you know this, but it's a little frightening to look a goat in the eye. And so I've resisted goats. Then she wanted miniature horses, which I know we don't have room for miniature horses. But I expect
Sean, look at
we'll
this.
have all of the above.
Look at this picture. There's a miniature horse in this nursing home or assisted living facility, and he fits perfectly.
I see, and he's bigger
That
than
is
the one she's looking at. That he's almost like what my grandfather used to call a Shetland pony.
Oh, yeah.
But the miniature horses, I mean, are about really the size of a lab, I guess.
Yeah.
But even, I don't know. If anything, I sort of like the fainting goat. It's probably my favorite animal.
And I just wanted to point out some of these pictures, like in the bottom left-hand corner, the little boy brushing the boxer. That would be an example of using animals in a kind of an occupational therapy setting. They're practicing sort of fine motor skills. The brushing of the dog helps that little boy to practice kind of hand-eye movement, hand-eye coordination. You have next to him, the little girl who's walking the dog blindfolded. I guess that's kind of like physical therapy. The man next to her who's balancing on that ball and the dog is pulling the rope toy. I imagine that's some kind of core stability, core strengthening that he's doing in the presence of a physical therapist. So those would be examples of animal assisted therapy. Whereas the ones above them, the llama and the doodle with the lady in bed, the miniature horse, those would be examples of animal assisted activities, just a general interaction. So
I wanted to read, you got great presentation. You were wonderful. Hand and Paw visited Princeton when I worked there. The most meaningful visit was a dog comforting young children of a hospice patient. The entire unit cried that day.
yes.
I'm having trouble getting
if I had more time, I would share stories about just my experiences taking my own animals into places. I mean, I've had similar experiences of interacting with people in a hospice setting that were nonverbal. They pet a dog for 15 minutes and all of a sudden they turn to me and speak. I'm like, at the WOW program, I mean, I've been able to establish rapport with those residents to the point where I had an incident where one student disclosed some suicidal thoughts that she was having, and she was about to be discharged and hadn't told anybody. And, because she felt comfortable with me and my pet in disclosing that, we were actually able to help her in the long run. I mean, there's just all kinds of testimonials out there. I mean, it's a wonderful resource. It really is. And I really encourage everybody to look into it, whether it's with Hand and Paw, or you can go on Pet Partners and look for individuals that are certified in the community or in your area. Please, just research it, see if it's something that could be useful to you.
Well, it's certainly, we appreciate your interest in it and the utility of it that you brought to others. We're a good bit past our hour. gonna
No, I'm
end
sorry.
this
I'll
now.
shut up now.
Thank you again, Holly. You did a great job, and we could talk all day. I hope those of you on the line will join us on Monday. We have Phyllis Grauer, who's a noted hospice pharmacist, who will be talking about pain relief for the elderly. That will be interesting. And then we have other good presentations throughout the month that you can find on carepatrol.com under my landing page. My name is Sean Barnes. Thank you so much. I'll copy Holly on the email with certificate so y'all can reach out to her. Thank you, Holly. Thank you, everyone. Have a great weekend.
All right, bye.
Bye. If I never can get this to work either. And. See, it disappears before you can get it to end. So frustrating.
I don't see anything having disappeared.
Yeah, and so like I'm here looking frantic on this thing and feeling foolish, and I can't get it to work. So let's see what else we can do. Well, y'all that are here, you can drop off.